Hi, I'm Dr. Millia. I'm a consultant psychiatrist and I'm also a trauma specialist. I work at the First Psychiatry Clinic, Dubai. So I'm here to talk to you about a therapy called EMDR. Some people call it eye movement therapy. I've been using this modality of therapy for the last 25 years. So I just want to speak for it a little bit more in detail. So trauma is ubiquitous. It's many of us have experienced trauma, and many of us know what is traumatic. Maybe something that has happened in the past, and we have still a felt sense of that experience even in the current time. And sometimes this memory of the experience that is still remains somewhere in our system, maybe the traces of it, or maybe even strong emotions of it, even a strong sensation of it or something that we have learned about that experience still informs how we operate in the present, but also in the future. When trauma is unresolved, sometimes the intensity is severe and we call it a post traumatic stress disorder. It has physical, emotional, and impact on us and how we respond and relate to others and ourselves as well. So, EMDR does have a substantial amount of research to support its use. And many therapies can help trauma, and EMDR is one of them. And again, EMDR is not for everyone, and not all therapies are for everyone anyway. So, trauma can be discrete, can be intensely shocking, even though discrete, or some of them are more slow, gradual, and may involve some repeated shocking moments. Or it could be developmental, where it's been a gradual experience, repeated criticisms, humiliations, shamings, neglect, abandonment, and so on. And some are from intentional people hurting us, and others are natural disasters, environmental disasters. Some are more interpersonal, relationally, where we've been traumatized, betrayed, hurt, and so on. Others happen in the context of unintentionally situations like a road traffic accident and so on. Some are in adult life only, and some are developmental from childhood, but also from infancy as well. So, EMDR was a chance observation by Francine Shapiro. Francine Shapiro, in the late 1980s, was walking in the park and observed that she had some disturbing memories about certain of something of her past. And while she was walking, um, she also noticed very rapid eye movements while she was also thinking about what had happened, and with that, the disturbance of the experience resolved, and she then sort of backtracked to see what may have happened in that very moment, and she found that these memories were dissipating in their disturbance through rapid eye movements. And that really sort of started her curiosity. And what she developed as just a desensitization technique, desensitizing memories, it has evolved over time to a structured psychotherapy. More elements got included over time. So, the key principles of EMDR is AIP, Adaptive Information Processing. Essentially, what it means is that we all have the innate capacity to process information, even the negative information, and that resource is within all of us. But when things are very disturbing and traumatic, the our innate ability to process that is somehow kind of stalled, and that information that we have experienced that is overwhelmed us or is negative or disturbing remains unprocessed and somehow stays in our bodies and thoughts, our emotions, beliefs about ourselves in the original format, in the original state it was experienced. So it gets isolated somewhere and somehow doesn't link up to any other perspective. The wider perspective, we call it adaptive information, the helpful information that can help us kind of not stay stuck in that moment of that experience. But unfortunately, whatever happens, that memories of those experiences continue to replay in our lives in some ways, and the original beliefs, sensations, and thoughts and feelings continue to replay as well. And the perspectives about ourselves, like I'm unlovable, I'm unworthy, or I'm unsafe, or I am responsible, and so on, continue to bring all sorts of emotional responses for us. So, if the incoming information is distressing, traumatic, this information almost halts that innate ability for us to process it. We can ruminate, we think about it, we talk about it, but somehow it remains like that undigested food within us, unresolved. So the symptoms continue to come up. And if it's severe, then it's flashbacks, nightmares, ruminating over and over again, and intrusive memories, so on, continue. So the eye movements is an important key thing while recalling the memory. Somehow it opens up neural paths to other related channels of memory and help that memory that is frozen in time in the past to reconnect with other helpful information. And it's not just eye movements. You can use tapping, you can use many other ways that are alternating and bilateral. So, EMDR therapy, from a broader memories perspective, how do we actually narrow it down? Often, a memory has a disturbing part of the memory, which is a snapshot of that worst moment. And also, some beliefs could be attached to that, like I'm unlovable, unworthy, and an emotion would be attached. It could be several emotions, a bundle of it felt as a disturbance and a physiological disturbance somewhere in the body. It is heart or chest or stomach or wherever it is. We often elicit this in the phase 3 part of the EMDR, which is the third part of the EMDR. EMDR is not just a technique, it has a 8 phase to it, a preparation phase, a processing phase, reintegration phase. There's many of those aspects of EMDR that a therapist would need to kind of operate within rather than just a trauma processing, immediately going into trauma processing. We need some preparation towards, and sometimes we do a lot of resourcing work in order to move towards what might be painful and traumatic. And we don't often encourage self therapy because I have seen clients come from EMDR self therapy and have got destabilized as a result of that. So I certainly wouldn't encourage self therapy. The protocol of EMDR also draws not just about past memories, but also recent triggers that are operating from that past experience that is unresolved, and also how we look at the future, how we view about the future as well. So hope this information is of help to you in informing and maybe kind of maybe understanding the therapy at the very least. This is not a full information, and if you need a full information, speaking to a EMDR therapist, a practitioner, or a consultant, and someone who is experienced can explain the full scale of the EMDR therapy for you. Thank you for watching.